Joining us now with more on the health care debate is Massachusetts 5th District Congresswoman Niki Tsongas. Nice to have you here. Thank you for coming.
Thanks, Chet. Good to be here.
Hey, you've had a couple of these town hall meetings, in Chelmsford and in Hudson, but nothing quite as explosive as we've seen. What sort of reaction, how would you characterize it generally?
Well, you know, obviously the first one I had was just as we received news reports from other parts of the country about these very energized town halls, and there was certainly a contingent there that came equally energized, but we managed to have a good discussion because the other side was well represented as well, people who really are very supportive of reform, and then a good number in the middle who just have questions and wanted to have a chance to ask them and hopefully hear an answer. And sometimes it was tough. But we managed to get through it and I think start to address people's concerns. We did a second one in Hudson. It was more traditional town hall in that people were more deferential to each other and willing to hear me out. And then today I actually did a radio show for an hour and a half talking about health care. And again, I think you see more and more people sort of drilling down a little bit, having worked through some of the things that have been shown to be patently false and ready to talk about the real stuff that's out there.
You get a sense that there's a lot of anger out there, that people are frustrated. They don't trust the government to run something as important as health care.
Well, I think there's no denying there are just a certain part of our population that doesn't, embrace the role of the federal government on this or really pretty much anything else. But the way I look at it is in this instance where you have so many players, whether it's someone seeking insurance or insured, an employer trying to provide health insurance, somebody who's uninsured, doctors, hospitals, so many players, there's really no other entity that can act as a convener of bringing people together and trying to create a partnership between all these different players in the system. And it's a fundamental role that I think we have to play given the challenges of doing nothing.
Do you think, though, that the president is just trying to move too fast on something as complicated as this health care reform issue is?
Well, we do hear that a lot, but in one of the telephone town halls I did, there was a gentleman who was 85, and he said he campaigned for Harry Truman on the issue of health insurance. So that's 60 years ago. And we're still talking about this great challenge we have, and it's become ever more important. Since most major presidential candidates, President Obama and Senator McCain, agreed that health insurance reform of our health care system was fundamental to the system itself and to our economy. And so President Obama is fulfilling a promise, and we've had over 60 hearings in Congress on this issue. So I think really it's being fully vetted, but there's no denying that it's complicated and it takes some time. And the great benefit of this August period has been that we have been able to get out there and talk about it.
Doesn't the cost scare you?
Yes, but the cost of doing nothing scares me too. So you see figures that says that the average health insurance premium will rise $1,800 a year if we do nothing. So if you get your insurance through your employer, you may not see that huge increase because your employer is grappling with it. But I talk with many employers who worry very much about how they're going to continue to provide coverage. If we do nothing, within 10 years, 1 out of $5 generated by our entire economy will go to health care. If we do nothing, 1 out of 5 employers within 10 years may have to drop their employer-based health insurance. And the underlying issue of the escalating cost of care is not going to go away. So it's hard to measure doing nothing unless we do nothing. And that's just not, I don't think that's a legitimate choice.
Are you confident that there will be something passed by both houses? I think the Senate's going to look at it first, but both houses will have had a vote within the next month?
Well, I think by the end of the year. I think the goal is to, before we come to the end of the year, to have both houses have addressed it and passed it and sent it on to President Obama for signature.
Well, good luck, Congresswoman Niki Tsongas from the 5th Congressional District. Appreciate you being here.
Thanks, Ted.
Now,